This is a really good question. What are the causes of preterm labour and birth? Spontaneous preterm labour and birth refers to the unintentional and unplanned delivery of a baby before the 37th week of pregnancy. Most of the time, these types of deliveries happen spontaneously and we don't know the reason. Sometimes these type of deliveries are planned because it's unsafe for the baby or for the mum, and we just need to try and ensure a better outcome than if we allowed the pregnancy to proceed all the way to term. An example of this is if there is multiple pregnancy. So labour will generally be induced earlier in the pregnancy, or a C-section will be planned preterm. Some of the risk factors that lead to a premature labour include things like if you've had one before, you're more likely to have one again. If you have become pregnant less than 6 months after your last pregnancy, research suggests that there is a slightly increased risk of preterm premature labour. Some of the other causes of a premature birth include polyhydramnios, which means too much amniotic fluid, placenta previa, uterine or cervical abnormalities, things like gestational diabetes, if you have a pre-existing history of type 1 or type 2 diabetes. There are loads of causes for a preterm premature birth,